Hi, I am Dr. Vivek. Today I am going to talk about a common bacterial infection in chicken, that is, Infectious Coryza. Infectious Coryza is a highly contagious disease of the upper respiratory tract in poultry which can turn into chronic respiratory disease. The causative agent of this disease is gram-negative rod-shaped bacteria known as Haemophilus purpellinum. The incubation period of this disease is 1 to 3 days. Usually, the disease lasts for 2 to 3 weeks. However, in association with other infections like mycoplasmosis, the disease can persist for a longer duration. Now let's talk about how this disease spreads. The disease is usually transmitted by chronically infected birds. The recovered birds act as chronic carriers. Airborne transmission and transmission by contaminated drinking water occurs. Infectious coryza disease is less severe in immature birds as compared to mature ones. In the absence of concurrent infection, the disease is recovered within 2 to 3 weeks. One important thing to note is, there is no vertical transmission of this disease from parent to progenies. Birds infected by infectious coryza show the following clinical signs. The disease is characterized by rapid onset. Morbidity is high. However, mortality is low. Infected birds show poor growth performance. Feed and water consumption declines. Egg production drops in laying birds. Continuing with the clinical signs of the disease. Seromucoid nasal and ocular discharge occurs in infected birds. There is edema of the facial region. Conjunctivitis and swelling of wattles occur. Infected birds find difficulty in breathing. There is foul odor in the flock. The clinical signs persist for a few weeks. However, if there is a secondary infection, the clinical signs can persist for a month. The first picture in this slide shows facial swelling and conjunctivitis in a broiler infected by coryza. The second picture here shows how dull, depressed, and listless the infected broiler has become. Obviously, there is no possibility of achieving optimum growth performance from such dull and depressed birds. This is a coryza-infected broiler. Look at the swollen head area, ocular tissue and wattles. You can also see how thick brown discharges are coming from eye and nostril. A similar case as described in the preceding slide. Swollen head area, ocular tissue and wattles in a coryza-infected broiler. A thick brown discharge from the nose and a clear discharge from the eye. Here in this picture, we can see a clear mucoid nasal discharge, plus swollen eyelids and skin around the eye in a broiler infected by infectious coryza. Now let's talk about the post-mortem lesions that can be observed in this disease. See the diffuse caseous inflammation of air sac in a bird infected by infectious coryza. In this picture, we can see catarrhal inflammation of nasal passages and sinuses in a coryza-infected broiler. Swollen face and wattle observed in infectious coryza must be differentiated from the following diseases. Fowl cholera, Newcastle disease, infectious bronchitis, avian influenza, mycoplasmosis, infectious laryngotracheitis. In order to control this contagious disease, the following important points must be taken into consideration and practiced. All-in all-out system of poultry rearing must be practiced to avoid the transmission and spread of this disease. Rearing of different age groups birds in the same shed must be strictly avoided. Strict measures of farm biosecurity must be adopted. Birds can be vaccinated against this disease at any time after 6 weeks of age, and a booster dose should be given after 5 weeks. Treatment. Fluoroquinolone group of antibiotics seems to be effective against Haemophilus purulenta. We can treat the infected flock with enrofloxacin or levofloxacin for the first 3 days and then give sulfatrimethoprim for 7 to 10 days. To prevent the possible recurrent infection, sulfatrimethoprim can be given at 3 days intervals for 2 times for 3 days followed by the first treatment. Proper disinfection and supportive administration of vitamin C, liver tonic and kidney tonic help to make treatment faster and more effective. Thank you very much for your time and patience. Was this video useful? Please put your views in comment box. If you have any questions regarding poultry disease, please don't hesitate to put them in the comment box. To see more similar videos relating to poultry diseases, please subscribe our YouTube channel Blue Cross. Thank you all. Have a nice day.